my name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at Hamilton Health Sciences. Really pleased to be back here in the role of moderator for our town hall. Today's town hall agenda is totally packed with updates on all sorts of important things. We will have the chance for everyone to ask questions at the end. We'll also have the chance for celebrations at the end of our presentations. If you wish to ask a question during the course of the presentations, you can also do that. You can pose your question. Please use the Q&A function. We'll reserve the chat function for our celebrations. We'll use the Q&A, question and answers, for our question and answers. And you can pose questions as we go. And I know our experts do a really fabulous job at responding to your questions. And you can review their responses as we go too in the questions answered tab. So just at the bottom of your screen there, you'll see Q&A. You can go in there, you can see what's been asked and what's been answered. And at the end, we'll do some live questions too, where we'll ask people to raise their hands if you'd like to ask a question live. Same goes for celebration. So, all right, that's the housekeeping out of the way. It's Thursday, September 2nd. We have a town hall to go, so let's do it. First up, our President and CEO, Rob McIsaac, will kick things off. So Rob, over to you.
Thanks very much, Aaron, and hello, everybody. Thanks for joining our town hall today. It's become our practice that we open today's every session with our land acknowledgement. So I want to say that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. I also want to mention that September 30 is Orange Shirt Day and Canada's first National Day of Truth and Reconciliation. You'll be hearing more about our plans to mark this important observance at HHS in the coming days and weeks. Moving on to operations, while we've been working to increase our level of patient care activity and get back to some degree of normalcy in our operations, the pandemic continues to throw curveballs our way. Dealing with those has been made more difficult because of the challenges associated with a shortage of health human resources with health professionals, and the need to ensure that our team of staff and physicians are able to just get a break from all that we've been doing over the past 18 months. We've invested a lot of energy into addressing what is a global issue related to staffing. Recruitment efforts are underway, and we're doing everything possible to ensure that our hospital can continue to care for all of our patients. I should say, on behalf of all of HHS leadership, we're super grateful to all of you for your ongoing dedication to our patients and to our community. I'm optimistic that we are in the final rounds of the fight against the pandemic, but to state the obvious, the fight is not over yet. We made some progress over this summer on health system recovery, trying to get back to serving some of the patients that we usually serve. We returned staff to their home teams after the redeployments that became necessary during Wave 3. We reopened the urgent care center, and the continued ramp up of surgeries and procedures took place. However, as I was just saying, the fourth wave of COVID is upon us and case counts are rising again. So we are once again having to focus on COVID-related patient care needs. We've reactivated the regional load balancing capacity group and are working with our partners to plan for surges in adult and pediatric ICU capacity needs, and of course on the wards. This week, we also reopened our assessment center at our Main Street West site. We know that vaccination is our best defense against the Delta variant, and we are working fully to implement the provincial directive mandating vaccination policies and testing. Details surrounding the directive are available on the hub and through the daily dispatch. I think everyone, in theory, ought to have reported their vaccination status and shared proof of vaccination by now. I know there have been some glitches, so I would just say if you haven't done this, please do so as soon as possible. And to be clear, this is a new requirement. So that means that if you haven't already, if you have already reported your status under our earlier request, you have to do so again, along with proof of vaccination. I know that isn't ideal, but it's such a changing situation, and we absolutely must comply with the terms of the directive. So I'm sorry if you are having to do it again. If you haven't done it again, please do so as soon as possible. So under the directive, individuals who are not fully vaccinated against COVID-19 will be required to undertake regular testing along with receiving education. You should know that the approach outlined in the directive is a minimum standard. And as you would expect of a health sciences center, HHS will be doing more than the minimum. So work is underway to roll out our new vaccination policy. That will happen on September 7th in accordance with the provincial directive. The policy is about the safety and well-being of patients and everyone else at our sites. This will include requiring all new hires to HHS to be fully vaccinated against COVID. We want to do everything possible to ensure that we are reducing the possibility of COVID entering our hospital inadvertently. The Delta variant is highly contagious, as everybody knows. And as I stated earlier, vaccination is a key weapon in the fight to protect everybody. Over the coming weeks, we'll be monitoring our progress, assessing the risk of staff not being 100% fully vaccinated, and we will adjust our approach with a view to getting 100% of people working at HHS fully vaccinated. Now, to be clear on this, if necessary, we will implement increasingly stringent measures to ensure as many staff as possible get the vaccine. If necessary, those measures will include progressive discipline, up to and including dismissal for persons not following HHS policies. I really hope this isn't necessary. We will give people a fair chance to comply with the policy as it evolves over time. But my view is that before this month is finished, I expect we will have implemented all measures at our disposal to achieve compliance with that goal. We will not have any patience for people who are not taking this seriously, nor will we make accommodations for those who are relying on nonsensical conspiracy theories. As workers at one of Canada's leading health sciences organizations, we expect people to follow the science. Every one of us has an obligation to protect our coworkers and the patients we care for at HHS. If you haven't been vaccinated yet, do it now. If you are vaccinated and haven't provided evidence of that yet, as I asked earlier, please do it now. And to the vast majority of our workforce who have been vaccinated and reported their status, I want to say a sincere thank you for leading by example. Now, just before I turn it back to the team, I want to acknowledge the ongoing work to ready our hospital for the installation of EPIC, our new health information system. That is going very quickly, and next June we'll be ready to go live. This is a really critical step in modernizing our hospital and further enhancing the safety and quality of care at Hamilton Health Sciences. And the team is now looking for individuals who can support their colleagues with training next spring and during the go live next summer. I would just encourage you to speak with your leader about this initiative. And as we get closer to going live and as our understanding of what this new system can do for us, I have to say it's very hard not to be excited about the project and all of the possibility that it unfolds for us here at HHS. So again, if you can and are interested in getting involved, please do so, and please talk to your leader. So having said all of that, I want to say thanks again to everyone for being here today, and back over to you, Aaron.
Thanks, Rob. Sorry, a little slow on the draw there. I was trying to answer some questions coming in our Q&A function. Just a reminder to all our participants, we're going to use the chat function for our celebrations. You can post questions in the Q&A function. So thank you for that. And next up, we have our Chief Operating Officer and clinical EVP of Clinical Operations. Sorry, Sharon Pearson here with us to give us an operational update on what's happening across our sites and services. Sharon, over to you.
Thank you, Aaron, for that elegant introduction. Good afternoon, everyone. Just a few specific comments about the operations across our sites. And much of my message is a bit of an iteration of what you've heard before. From a demand perspective, our services continue to see significant pressures. We've been running with high occupancy throughout the summer, and we've even seen a step up in that occupancy over the last few weeks. Particularly at our adult acute setting sites that have been running well over 100% for a few weeks now. And that's driven in part by an increased volume in ED visits that we're seeing. And that increase is 12% compared to last summer. Now volumes were down a little bit last summer, but it is still a significant increase for us. And we're seeing specific demands across our clinical services. Certainly would highlight the demand that we're seeing in labor and delivery. And again, I mentioned last town hall that it was a record high rate of deliveries. And again, every month we exceed the previous month. So there are pressures abound over our sites. From an outflow perspective, we are seeing a reduction in our flow to our post-acute services, and that in part is driven by the health human resource challenges that are being faced across a number of community providers, as well as the long-term care home occupancy has really returned to normal. So we're not seeing that typical or what was atypical increased flow to long-term care over the summer. And in terms of where we're at with our surgical procedural activity, in light of all these pressures, we are still not at 100% of our pre-COVID surgical volumes. If we could go to the next slide, from a specific snapshot of where we're at with our critical care and specifically COVID, you can see the number of CRCI and COVID patients in the ICU. There's 13 plus the 9, then we have 15 at the ward. We continue to see a high demand for ECMO, which we anticipate will carry on through wave 5. And just a reminder, Hamilton Health Sciences and London Health Centre are the two tertiary sites that provide this treatment for Ontario West. So it's a very finite service serving a very large population. If we go to the next slide, in terms of what we're doing for wave 4 preparations, and Rob touched on several of these in his opening remarks, certainly a lot of site-based planning and conversations as to managing through wave 4 and what we'll do compared to what we did in wave 3 with respect to our staffing and our care models. We are relooking at the Ontario West COVID model. If you recall, in wave 3, the Hamilton General and then the Juravinski site was designated as a COVID site. So we're working with our partners to determine which sites will be those regional accepting sites through wave 4. Further again to ECMO, we're looking at even load balancing between London and ourselves to ensure that we're trying to, or we are maintaining access to our other critical care services and our regional access. We have worked to increase capacity at the Satellite Health Facility to offset those ALC pressures. So we have added different modalities in terms of being able to take different populations at the satellite health facility, including adding some ability to take patients with oxygen and some patients with some minimal behaviors as well. Significant focus, as you would expect, on pediatric planning led by Bruce, planning within our own children's hospital, but also playing a significant role in the regional planning, and of course, planning with the other pediatric hospitals across the province. As Rob mentioned, we did reopen the assessment center, and as did St. Joe's opened the East End Assessment Center as well. And that was really in response to the increasing volume that was being seen over recent weeks and anticipated increase with the school reopening for testing. So as of yesterday, back in business at the West End, and the urgent care again will be back to full hours as of September 7th, but it has been open for several weeks now. So an abundance of activity. Happy to take questions through the Q&A or later on and add any specifics. So back to you, Aaron.
Thanks very much, Sharon. Great update today. Next up on our agenda, we're very lucky to have with us Dr. Fiona Smale, who is a medical microbiologist and expert in infectious diseases, and able to give us a bit of an update around the epidemiology of the pandemic and some of the other issues around vaccination, et cetera. So Dr. Smale, over to you.
Thank you, Aaron. I'll be just brief in my update of the epidemiology, as there are a lot of important questions to discuss today. We clearly are in the fourth wave of COVID here in Hamilton and in Ontario. And what I just wanted to do was highlight that Dr. Mertz presented a couple of weeks ago some of the projections around the increased number of cases. We have already surpassed the number of cases. Our daily rates are about 75, so we're about 2 weeks earlier than the projections in terms of the increased number of cases. What we don't know, however, is what those curves are going to look like. And it's very clear that vaccination rates as high as possible and maintaining public health precautions are going to be the factors that will lead to a flattening of these rates. With low vaccination rates and a reduction in public health, the fear is that we could see a very high fourth wave. And so that's where a lot of the resources are being placed at the moment, so that we don't see that increased rate. I've just noticed that the slides seem to be a little bit cut off at the bottom. I'm not quite sure if there's something that can be done to correct that. Anyway, can we move on to the second, next slide, please? What I've done in this slide is from August to the month of August, identify the risk factors for acquiring COVID infection in Hamilton. You'll see that the orangey color is an outbreak, and while we continue to see outbreaks, these are relatively minor in terms of the number of cases. The pink is the number of close contacts, but what is of concern is the green bars and the purple bars where there is no known epilink. And so that reflects to us community spread without a identified close contact. And it's because of these numbers that you will have noticed we have now moved to a non-low epi approach to managing COVID within our hospitals. And that includes increased screening of pre-op patients who have not been fully vaccinated. And if patients do present with symptoms that could be COVID, even if we could explain them by some other reason, we are still recommending now that all of these patients with any symptoms that could be COVID associated are tested for COVID infection. Next slide. One of the concerns that a lot of people have is how effective is vaccination against getting infection getting hospitalized, and of course, more serious complications. And these are data from the Ontario Science Table, updated just yesterday, looking at the effect of vaccination on COVID cases. And you can see here that the reduction associated with full vaccination is 85%. When we go down to hospital occupancy, the reduction is 95%. And vaccine will prevent ICU occupancy almost close to 97%. So these are very convincing numbers to validate the importance of vaccination, despite some of the concerns that people are expressing around how well the vaccines work, particularly against the new variants. And my last slide now. This shows over the past 20 weeks or so, the type of variants that we are seeing in Ontario. You will recall from the beginning what we had was what we call the Alpha variant. And then over time, this has become replaced with the Delta variant. And this reflects probably around 99% of the cases that we are seeing in Hamilton and across Ontario. There is a new variant that has just been identified, the B1621, which has now got a proper name called Mu. But these numbers seem to be relatively low and not increasing. So I think while we continue to be aware of it, there is no immediate concern that this is going to become a predominant variant in Ontario. So I'll stop there, pass back to Aaron, and continue to answer any questions that come up.
Thank you, Dr. Smale. And I just want to point out to those that are posing questions in our Q&A function that a number have been answered. You can review those in the Answer tab, which is at the top of the Q&A function. And for those that continue to pose questions in the chat function, your best bet to get an answer is to put it in the Q&A section. That's where our presenters are monitoring to give a response. And it also respectfully reserves that channel for us to be able to use it for celebrations, which we want to do throughout the course of the webinar, but for sure at the end as well. Next up on our agenda, we have Bruce Squires, who's our president at McMaster Children's Hospital and also our VP of Women's and Children's Health, and has been working diligently in the vaccination effort to help implement the policies that have come from the government right now. So Bruce, why don't you tell us a little bit about where we're at and what we can expect?
Thanks very much, Aaron. Good morning, folks. I and others have been providing updates on vaccination for 8 months now, and we've been doing that because all along we've known that vaccination is a really key strategy in our fight to end the COVID-19 pandemic. And progress has been made. In Hamilton, we're at 80% of the eligible population has received a first dose, and around 72%, more than that, close to 73% have received both doses of the COVID-19 vaccine. But as Rob has outlined, the Delta variant and the fact that we are in wave 4 of this pandemic mean that more is required. And I'll say that's why we're talking to you today about this issue of the mandatory reporting requirements and the vaccination policies. And so I'm just going to take a minute here to talk about that. First of all, I do want to highlight that we are looking to work in an alignment and together with partners across the province, but particularly across the region. And so a little over 2 weeks ago, Rob, our CEO, and other CEOs from the HNHB sub-region wrote to all of our teams and publicly to demonstrate the alignment they have with respect to the efforts with respect to vaccination of our teams. In alignment with the directive from the Chief Medical Officer of Health, they all committed to move to make reporting of vaccination status mandatory, required for everyone at our organizations. That includes staff, physicians, and volunteers. As you can see from this slide, to date, since we created the ability for you to upload the proof of vaccination status, which took effect late in the day on the 29th. Over 5,600 individuals at HHS have now self-reported. That's a great number. We need to get to all. Those CEOs also committed to move it effective September 7th, where all new hires will be required to have completed full vaccination. Again, that's something that's being done in concert and alignment with our partners. Perhaps most importantly, they've expressed their commitment that our goal is 100% vaccination of all of our people, which includes staff, physician, and volunteers. It's understandable that folks ask questions around the visitor vaccination policy, or policies for others, for visitors, including caregivers. That's something that continues to be under discussion as we consider both the needs of our caregivers, but also how to continue to provide the best protection for staff, families, patients, and others. So let's move to the next slide. And in this slide, I'll talk a little bit about the Chief Medical Officer of Health's directive issued on August 17th. And again, the origin of that directive relates to the importance of vaccination and the urgency of our situation in Ontario with respect to wave 4 and the highly infectious Delta variant. And the guidance that the directive provided for all hospitals, as well as a number of other health sectors, was that we needed to, by September 7th, have in place a vaccination policy for the organization. And there were some key components to that vaccination policy. One of them would be a requirement that all of the members of that organization, and you can see the bottom, it applies to staff, physicians, contractors, volunteers, and our learners. All of these individuals are required to provide proof of their vaccination against COVID-19. And that proof of full vaccination, of course, means the receipt of both doses, or proof of a documented medical reason for not being vaccinated against COVID-19, or if neither of those two things, then they are required to complete an educational session on the importance and about the COVID-19 vaccination. Regardless of a reason as to why someone may not have completed full vaccination, those who are not fully vaccinated will be required to undertake regular testing. And again, these are the policies that are required of HHS as an organization, as a minimum standard under the directive issued by the Chief Medical Officer of Health. So I'd like to go to the next slide, please. Next slide, mention of medical exemptions as one of those reasons that an individual may not have completed a full vaccination series. And Directive 6 requires in those circumstances that the individual provide proof of a documented medical reason. That documentation needs to be from a physician or nurse practitioner, and the effective time period for that medical reason. Since that has been produced, the Medical Officer of Health in the Hamilton region has issued further guidance with respect to medical exemptions, outlining that those are only applicable when there is an allergy directly to components of the COVID-19 vaccination, or where there was a specific myocardial or pericarditis reaction to the first dose of a COVID-19 vaccination. Further detail around that will be is certainly posted on public websites, Hamilton Health Sciences as well. We'll post that information. The organization will also need to and is considering where individuals may request exemptions based on religion and creed under the Ontario Human Rights Code. So there's additional information to come there. Before I turn it over to other members of our team, I just want to highlight again that right now our focus needs to be on ensuring that we have clear reporting of vaccination status as required from every single member of our team. Unfortunately, and I have to say it that way, if you reported prior to August 29th, we have had to ask you to do that again, because in doing so, and to be compliant with the directive, we need you to provide the proof of that vaccination. And that is done through downloading your proof of vaccination from the Ontario vaccination website. We also need you to disclose if there is a medical exemption with that proof, or of course to disclose if you have not received full vaccination. That is a mandatory requirement under the directive, and one that we need to ask every single member of the team to complete. Recognize that at this time of year, some may be on vacation, but that doesn't change the requirement. So as soon as possible, we need you to complete that disclosure. All of the details on how to do that, in terms and including some very explicit guides on how to use the HHS tool, how to use the Ontario portal, as well as really some advice that certainly sometimes you may have to try a couple times, are included in the information that's been provided to you through email, as well as on the HHS Hub. So as I now turn it over to Susan Fucciarelli, our Director of Employee Health Services, and Tiffany Robland, Director of Labor Relations, to talk about the testing process, let me close by again thanking all of you for your commitment and effort to take this next step towards ensuring that we have the utmost levels of protection across HHS, and we take that next step, as Rob has talked about, in defeating this pandemic. So Aaron, back over to you.
Yeah, thanks very much, Bruce. So next up on our agenda, as Bruce said, is Susan Fucciarelli, who's our Director of Health, Safety and Wellness, to continue talking a little bit more about the testing, which I know some questions have come up in the Q&A, so pay close attention if your question was related to the testing. Susan, over to you.
Thanks, Aaron. And thanks, Bruce, for leading into this. As Bruce has indicated, our first and foremost priority is trying to provide the necessary tools in the time that people need to report their vaccine status. So that's really our push right now. We already know that there have been individuals who have submitted their vaccine reporting indicating that they are unvaccinated. So starting tomorrow, Friday, September the 3rd, we will begin sending out test kits to those individuals who have already declared that they are unvaccinated. We will be staging this approach, again, to give people the opportunity to report. We currently have around 6,000 reports, but we know that we still have a lot more to come in. So we will stage this process, and we are prioritizing and starting out with those who have declared that they are unvaccinated. All of the information related to the test kits will be included in that test kit. So all of the instructions about how to use it, there's a video, there are learning aids that are available. The kits are fairly easy to administer yourself, and to read that result. We're working through the process on how the results of those tests will be shared with Employee Health Services. At the outset, we are looking for people to validate. We will need to validate people have completed those tests. And so we will be working through those processes. Again, all of the specific instructions are included for those who will be receiving those tests. As of next week, we'll also have some test kits available in Employee Health Services. We're just preparing them all now. And so anybody who knows that they will be needing a test kit can also pick it up from one of our employee health offices. If you need to do the test and you have not yet picked up your kit, we will ensure that we're mailing that out to you. The kits will be provided by HHS, so there is no cost to you in related to the kits themselves. Once individuals do get their kits, they will be required to start using them right away. The testing is required twice per week, so Mondays and Thursdays. Again, this is only for asymptomatic testing. So if anybody does have symptoms, or if you've been a close contact and have been advised by public health to go for a PCR test, that will be arranged. So our normal processes for those who are experiencing symptoms are still in effect by way of contacting Employee Health Services, who will facilitate your testing at the HHS Assessment Center. So just reiterating that these home tests are for those individuals who are unvaccinated, and then we will be moving to those who have not yet reported starting next week and into the following week. So that's why it's really hugely important that you get your report in through the portal as soon as possible. As has already been mentioned, once we start going through this process, individuals who either are not submitting either their declaration one way or the other of whether or not they've been vaccinated, or who are not complying with the testing, if they're required to do that testing, we will have mechanisms within the policy that start looking at what that progressive discipline is going to look like, up to and including termination. So I think I'll turn it back over to you, Aaron.
Sounds good. Thanks, Susan. Thanks for that update. A lot baked in there. I hope people got answers to some of their questions in that session, but we'll come back to you later with other questions as needed. Next up on our agenda, we have Tiffany Roblin, who's our Director of Employee Labor Relations and Human Rights. Tiffany's going to give us an update about an important moment in the calendar coming up on September 30th, which is Orange Shirt Day, and also our first ever National Truth and Reconciliation Day. So Tiffany, tell us what we can expect.
Thanks, Aaron. And again, a big thanks to Rob as well for your opening remarks today as it relates to September 30th. So as Aaron just alluded to, September 30th is Orange Shirt Day. And for this year, it will be the first annual National Truth and Reconciliation Day. The Canadian government made September 30th National Truth and Reconciliation Day to complete one of the 94 calls to action from the Truth and Reconciliation Commission. The mandate of the Truth and Reconciliation Commission's final report is to inform all Canadians about what happened in residential schools. If you haven't already, we strongly encourage that you read this entire report. It is long and it's a very difficult read with many stories of abuse and suffering Indigenous children experienced. But it is vital that all Canadians choose to inform themselves about this shameful aspect of Canadian history. To support your learnings, we encourage everyone to utilize this Orange Shirt Day and National Truth and Reconciliation Day calendar, which you see before you. It features a number of learning opportunities. In collaboration with Indigenous staff and physicians across HHS, we have compiled 94 learning opportunities throughout the month of September, and we encourage you to engage with as many as possible as you can. You can access the calendar on our Human Rights and Inclusion Team Hub page. The link is also available. It was on the slide. I do see that it's been cut off, but it will be on the Hub and of course featured in upcoming HHS news releases throughout the month of September. We encourage everyone who is able to wear an orange shirt on September 30th to do so. You can visit, again, our Human Rights and Inclusion page on the Hub to find a list of Indigenous vendors selling orange shirts, we strongly recommend that you purchase your orange shirt from an Indigenous vendor. And again, do so as soon as possible, as many of those vendors are already selling out for this year. We encourage you to also tune in to upcoming town halls this month and keep an eye on the hub, as additional information and learning opportunities will be available to the HHS community. And back to you, Aaron.
Okay, thanks very much, Tiffany. I've been trying to keep up with the questions in our Q&A function. I know we have some outstanding, and for sure our panelists have done a very great job today answering questions as they've come in, typing furiously away and making sure that people get answers. We may not get to every topic today, but we'll do our best to get to many of them. And for those that have an unanswered question, I know there was in the Q&A post, like, how can I get more information about some of the topics that were spoken on at today's town hall? You can always email to the HHS News at hhsc.ca inbox, and we'll do our best to get information directly to you. You can always check the hub, which has a repository of information on all the topics that were addressed today. And we'll continue to pump out new information through the dispatch directly into your inbox so that you can have all the links to the most up-to-date information about vaccination, reporting, testing, and all of these topics, as well as the other celebratory moment on September 30th that Tiffany mentioned. Okay, so we have a few questions. I want to, maybe Dr. Smale, I could go to you first. I know you responded in some of your questions about the issue of a booster shot. You know, some people were asking generally, I guess my question to you is this a typical practice in vaccination, and what should we expect in relation to COVID?
Thanks, Aaron. I think the likelihood of a booster shot is relatively high. Do we need a booster shot now to control what we're dealing with? No. So my sense is that with potentially waning immunity over a period of time, as well as the changing variants, a booster shot will become part of how we manage this. But we should not be focusing on booster shots now. We should be focusing on getting our vaccination, our fully vaccination rates up to greater than 85 to 90%. And of course, if we can prevent transmission in the community, the requirement of a booster shot is much, much lower. So let's get those vaccination rates up higher.
Yeah, wonderful. Thank you very much for that response. There is another question that came in. I think that thematically, I'm trying to go through some of them thematically. There was questions raised about, you know, just generally speaking, the legality of this policy. I'm wondering, maybe Rob, if I could ask you to comment on that. There was, you know, some questions about, hey, how do I contact the legal team, et cetera? You know, knowing that this is a directive from the Chief Medical Officer of Health, HHS is doing what all hospitals in Ontario are doing. Like, how would you characterize that for our workforce?
Yeah, of course, you know, we are legally obliged to comply with and enforce the directive that has been handed down to us. So I don't think there's any doubt about our duty to do that. In my own view, the legality of that. As we develop our own internal vaccination policy, which just a reminder, the directive is the bare minimum, and I fully expect that HHS will be going beyond the minimum with our own vaccination policies. We are doing that in close consultation with our legal department. Our in-house general counsel is part of the team that's helping to develop the vaccination policy. So I have a good deal of confidence that what we are doing is entirely legal. We will be respecting people's human rights. We will be making sure that people who have a legitimate exemption are respected for that. But as I stated earlier, we do also expect that everyone who does not have one of those valid reasons for not getting vaccinated will get vaccinated. And you know, having to take a vaccine to work in healthcare is nothing new. And everybody who works here now has already had to comply with that requirement with respect to other vaccinations. So I do think we are on very solid ground.
Thanks for that, Rob. Another thematic area I want to talk a little bit about is our visitation policy. I know Kirsten and perhaps Rob, you can talk a little bit about where we're at in terms of our journey with our visitation policy. The questions kind of gravitated around, will we be looking at constraining visitors as we enter the fourth wave? Where are we at now, and what can people expect to see?
And maybe I can kick it off and Kirsten can supplement. Kirsten and I have been discussing this at fair length over the past number of days and weeks. Our policy with respect to visitors is, I would say, under consideration. We will be developing and publishing that policy in consultation with our subject matter expert group. I do think it's a fairly dynamic situation, and there are issues that are raised with respect to vaccination policy for visitors that are different from the issues that are raised with respect to vaccination policy for workers. And so we want to be careful to ensure that whatever we do is appropriate and thoughtful and implementable. And so I would say stay tuned. We are working on it, and we will be doing it in a way that hopefully makes good sense. But maybe Kirsten can help to supplement that.
Yeah, we certainly do consult with our regional COVID subject matter expert team, which has a vast array of different experts around that table. The question around the number of visitors is in our policy right now, and we actually have contained that. So there is a section specific to the vaccination era that we're in right now, which is different than when we were in, either high or low epidemiology or prevalence back earlier in the year when the vaccination rates or vaccination wasn't even available at that point in time. But knowing that our community is at 72% vaccination rate, that brings us to a very much safer scenario, however, not without risk entirely. So our visitor policy is still allowing 2 names on a list. And, we have still and continued and just consulted again last week with our subject matter experts that the 2 at the bedside at any given point in time still right now is still okay. Again, we review that all the time. I'm hearing many questions, of course, from people around, do we need to insist that visitors coming to the organization be vaccinated? It's a very slippery slope, pardon me, but we're certainly checking what is happening elsewhere in the province, in the country, in the states as well, and also very mindful. I mean, our ombudsman for the province of Ontario certainly has just released a report as well around the implications of COVID and these restrictions on caregivers, family, and so on, and the big harm that created in the process as well. So this we have to take with a lot of compassion and also obviously, keeping people safe. So it is a very tricky, where do we land this and the matter particularly about the vaccinations. Anyways, I'll leave it at that, but more to come. But right now we continue to have, I would say, still a fairly constrained policy. We were actually hoping if unfortunately wave 4 wasn't materializing, that we actually would have had patients have more names on the list. But we have kind of stayed the course. So refer to the existing posted policy if you need. Thank you.
Thanks very much, Kirsten. I want to maybe go to you, Susan Fucciarelli, a little bit. I know you covered a lot of the info around testing that has been asked, but just maybe to underscore in some areas, reiterate maybe some new information related to the questions, like as it relates to the delivery of the tests and then taking of the test and then sending it back. I think that's where most of the questions are coming. Like, what can people expect in terms of receiving the tests at home and then, taking them and sending them in? Like, I know some of this is being developed as we go, but how will we assess that process as we move forward and make sure it's effective for everyone?
Right. Thanks, Aaron. Yeah. So just to make it clear, HHS is providing the test kits. So I've seen a number of questions related to that. So there is no cost to our staff for the test kits, we will be providing those. Again, there will be 2 different methods of getting your test kit. You can either pick it up through our EHS office, or we will be able to mail that directly to your home. We are asking that you ensure that you've got the correct address in your HR data. So if you are going to be requiring a test kit, please ensure that we do have your correct mailing information so that we get it to you. As far as the results, once you've done, it's a rapid test. You get the result within 15 minutes. Think of it sort of like a pregnancy test. So, you know, you do the test and then you're able to read it and it shows you whether or not it's negative or positive. And so again, those specific guidelines about what you will do with that, how you will get that information to us about it being negative, which enables you to come to work, then that information will be on the instruction sheet that you will get directly with the kit. If you get a positive result, then you must contact Employee Health Services, where we will then refer you to the assessment center for a more specific PCR test.
And in terms of knowing that somebody did the right thing and did the test on themselves, I mean, you assume someone that's unvaccinated would want to take the test, but I mean, how will we verify that?
So we'll be verifying that because it is considered personal health information. So that will all be done through Employee Health Services to protect the confidentiality and privacy of our staff and physicians.
Yeah, super important. Okay, well, thanks for that. Maybe, Dr. Smale, I could go back to you. Thematically, there was a lot of questions about the safety of the vaccine for different individuals based on their health status, their gender, et cetera. Where would you suggest, and I know you have in the answer tab, but for those that haven't seen, where would you suggest people go to get the best information, the most scientifically accurate information about the vaccines available today?
I recommend everybody bookmark the NACI, the National Advisory Committee on Immunization. They collate all of the data, both published reports as well as unpublished reports, and provide a reference really for every statement that they make. You can find summaries of that on public health sites, but if that is probably the best source for information, and that's what I recommend.
Wonderful, thank you for that. I also just want to highlight, there was a series of questions about, hey, I've tried to do my reporting, but I couldn't get in, the thing froze, et cetera. I know there have been technical glitches. We have been responding to some questions coming in at the HHS News inbox about this. Occasionally we get surges in people trying to report. If you do try again, it should work. There's just usually an overwhelming number of people trying to use the portal at the same time, and it can gum up. So please do try again. We've had some people who then flip us a note back saying, hey, yeah, tried it a little bit later and it worked. So please do that. Lastly, I just want to point out, we will have another town hall next week. We are planning for another town hall on this topic, specifically of vaccination and reporting, and any other important operational updates that we need to have in relation to the 4th wave. I know there's a ton of questions today, and we'll make sure to respond to additional questions in that forum and try and get answers back to people as well via email in between those 2 time periods to make sure that people are getting the info they need. You can always check back at the hub and see what has been updated, and you'll also get flags in your inbox through the dispatch. So I want to thank our presenters today for all of the effort that they put into answering questions. It was really something. There's still 48 sitting there. We've answered 66 in writing, and we'll continue to try and get the others queued up over the next week. And if we haven't gotten to something, then maybe we'll also just include it in the topics being covered at next week's town hall. With that, I want to move us to our celebrations. It's important that we take time to celebrate and acknowledge the amazing work that's happening across our organization, in our community, and in our province. So if you have a team, a person, a project that you want to celebrate, you can type that into the chat forum, and Rob and I will read it out. You can also raise your hand as a participant, and we'll call on you to ask to deliver your celebration live, which is a great way too. I want to maybe start today. I want to highlight some wonderful work that was done between the communications team and our experts at McMaster Children's Hospital to produce again another annual offering to the public about back to school. As such an important topic, many kids are back to school this week and some are headed next week. And people are asking a lot of questions as we're in the pandemic. And so they've produced an amazing set of resources that are available through the hub. They've been promoted throughout our community, and I think it's a real huge asset. I've reviewed them myself as my daughter's headed back to school next week. And I just want to thank that team for all the work that they put into that product. And if you haven't taken a look, please do so.
Yeah, Aaron, I just noticed congratulations with respect to the production of the calendar to Emmeline Gregoroff for creating the Indigenous calendar. Really great work, and a number of comments received when we put that up on the screen. So thanks very much, Emmeline.
I do see Emmeline with a hand up. Maybe we could go to her. She wants to make a comment or a celebration. So go ahead, Emmeline. You'll get a prompt to unmute, and then you just hit that and let her rip. Are you there?
I think so.
Oh, awesome.
Can you hear me?
Yeah, totally. Go ahead.
Okay, I just wanted to say thank you actually to my colleagues who shared their wisdom and expertise in the creation of that calendar, and wanted to specifically shout out Dina Clote, Stephanie Rowe-Jans, Corinne Hamilton, Dr. Patricia Ferrugia, Sarah Anderson, Wendy Sorosky, Nate Sorosky, Colleen Montour, and Michelle Jonathan, because that calendar really would not have been created without their wisdom and expertise.
Amazing, thanks. I'm going to assume you had a list in front of you when you wrote those names off, but that's great stuff. Thanks. I also have Patricia Power and Aaron Cardwell with a hand up. Maybe Patricia, we could go to you first. So you'll get a prompt. Just go ahead if you'd like to issue a celebration. Oh, those hands disappeared. So maybe they've already, maybe that was in error.
Another one in the chat box from Lucas Milinovich saying, I'd like to thank those who helped reestablish the assessment center at our West End Clinic location. Special thanks to Josh Dieker for his leadership. Hopefully I pronounced that correctly. And those who raised their hand to work there agreed. It was done so quickly and very responsive to what was happening in the community. So great shout out, Lucas.
Good stuff. I see Leslie Coche with a hand up. Leslie, what would you like to celebrate today?
I managed to get off of mute. Over the summer, we have been introducing the Omnicell medication cabinets from pharmacy, and that's a really big part of the pharmacy team getting ready for the Odyssey implementation. So I know it's been a tremendous amount of change for the frontline teams as these new cabinets have come on board. And I really want to do a shout out to Kim Botsforth for her leadership in the pharmacy team, implementing like a major change in practice. So it's like really exciting, and thank you to everybody.
Awesome. Thanks for that, Leslie. Let's see what else we have here in the chat box, Rob. Additional thanks from Tammy Packer as well to Josh and Lucas. That's great stuff. I'll do one more call out. Any of our presenters or any of our participants with a live celebration to make?
Aaron, it's Kirsten for a moment, if I could.
Yeah, please go ahead.
Let me get off camera here. So we had a wonderful opportunity last week to celebrate some bursary award winners with the support of some family trusts that we've had, our HHS Foundation, and then our volunteer association as well. So Melina Passalant, Tracy Carrier, Jane Roberts, Tammy McKenzie, Magda Wojtowski, and Aaron Walsh. So congratulations to all those folks. But it was, we did an in-person celebration. I just want to say, I'm so inspired by many of you who are probably on the line today too, also doing continuing education to further your careers and your curiosities and so on. It takes quite a bit of effort and great stories also about many parents, people like yourselves who are doing this in concert with kids who are also in school. So keep up the great work, everybody. Lifelong learning is so important for all of us these days. So way to go.
Awesome. Thanks for that. Well, thank you to everyone for participating today. Rob, maybe final word to you.
Yeah, thanks very much, Aaron. And thanks, as always, to everybody for being here today. I know we had to deliver some strong messages today, and I'm totally sure there were some people who did not receive those well. We take no pleasure in delivering messages like that, and we would not be doing it unless we were completely convinced that we needed to do so for the safety of your colleagues and for our patients, and ultimately for the good of our organization and this community. So thank you all, and thank you all for complying with the terms of that policy as we move forward. And with that, I'll sign off. Cheers, everybody.